So in the area of hepatitis C treatment, really the last couple of years have been revolutionary, and the next few years are going to be even more transformative in our ability to treat and in fact cure hepatitis C. So hepatitis C is a curable infection. Up until last year, we really only had one set of treatments for it. But beginning in last year and hopefully extending into the next few years, we're having, the FDA has been approving new treatments for hepatitis C. Those treatments will make the outcomes of treatment better, so more people will be getting cured of their hepatitis C. Hopefully they will make the treatment shorter and better tolerated. So the goals with our new treatments are to reduce side effects, shorten the duration of treatment, and increase the percent of people who actually get cured of their hepatitis C. And these new drugs really hold that promise for us. What we're doing in the field of HIV is transferring the knowledge that exists around hepatitis C monoinfection, meaning people who are HIV negative but have hepatitis C, which is where the bulk of the research with these new drugs has been done to date. We're transferring that knowledge into people who have both HIV and hepatitis C. So in the United States, about 30% of people with HIV also have hepatitis C. Primarily that's come through blood exposures, injection drug use, or back in the 1980s through blood transfusions, hemophiliacs, and as we've talked about, we're seeing more sexual transmission in HIV positive gay men. So all of those routes of shared transmission, if you will, between HIV and hepatitis C lead to this very high rate of co-infection, people who have both HIV and hepatitis C. And the treatment doesn't work as well in people who have HIV up to date. So what we really need in our field of HIV hepatitis C co-infection is to translate this information and let us learn about these new drugs in co-infection. What we're seeing from preliminary data is actually that they work very, very well. So it's extremely encouraging in our co-infected populations where the treatment up to date has been particularly poor, that these new drugs are really translating well into co-infection. We're seeing higher rates of cure, shorter duration of treatment, and better tolerated regimens on the horizon. We do have a few extra things to work out in HIV co-infection. For example, drug-to-drug interactions are problematic with some of the existing drugs. We can't use them with all of the HIV drugs that we have. So we have to understand those drug interactions, and we have to manage side effects which may occur more commonly in people who have both viruses. So there's a lot to learn, but the exciting thing is we are doing the work to understand that. Those research studies are ongoing here at UCSF and San Francisco General, as well as around the country and around the globe. And the preliminary results look incredibly encouraging. So we're very hopeful that the breakthroughs in hepatitis C will translate into HIV hepatitis C co-infection and offer our patients a much, much better chance of cure of their virus.